Good afternoon, everyone. I will be presenting the visual outcomes of sterile corneal infiltrates after photorefractive keratectomy. No financial disclosures. Photorefractive keratectomy is the oldest excimer laser-based technique used to alter refractive power of cornea. PRK avoids the production of corneal flap and hence eliminates the potential flap-related complications, thereby yielding safer and predictable results. Though a safe surgery, numerous complications have been reported following PRK, including corneal haze, overcorrection, undercorrection, scarring, regression, and corneal infiltrates. Corneal infiltrates following PRK can either be sterile or infective. As such, this is uncommon complication with fewer reports in literature. The purpose of this study is to analyze the visual outcomes following the successful treatment of sterile corneal infiltrates after PRK with topical steroids. It was a retrospective study, single-center study. Records of all 6,280 patients who underwent PRK for myopia and myopic astigmatism between 2014 and 2017 were reviewed, and 14 cases with sterile corneal infiltrate were included in the study. Factors studied are age, sex, time interval between the study and surgery and presentation, visual acuity at the presentation and last visit, location and size of infiltrate, and time for complete resolution have been considered. Results showed mean age is 27.42 years with female predisposition of 75%, and time of presentation following surgery is 3 days plus or minus 1.62 with present pinhole visual acuity at presentation is 0.19 logmer. Blepharitis is noted in 42.9% cases. And characteristics of infiltrate, location is peripheral in 92.86% and central in 7.14%, with the size of infiltrate being 2.07 mm. Follow-up period is around in 64.8 plus or minus 60.36 days, with the time of resolution 8.91 days, with our best corrected visual acuity at the last visit is 0.05 plus or minus 0.07 logmer, with scar is noted in 50% cases. We have compared between the fluoromethanol, prednisolone and loteprednol. There is no significant difference in the age, onset of presentation, visual acuity and time of resolution between these groups. The limitation of this study is it was a retrospective study, inability to access the risk factors involved in the pathogenesis of these infiltrates. The sample size for the comparison of outcome between fluoromethanol, prednisolone and loteprednol groups was inadequate. An objective analysis of residual scar formation was not done, which could have helped in evaluating the effect of scar in more detail. Our conclusions are sterile infiltrates following PRK can be effectively treated with aggressive topical steroids, as most of the patients have infiltrates in the periphery of the cornea and resolution takes place with the scar formation in periphery. The visual acuity of these patients remains good in most of the cases. The outcome is generally favorable, doesn't require surgical intervention if treated early. Thank you.
Thank you. That was good. What was the average duration? I might have missed it. What was the average duration of appearance of these infiltrates after
Most
PRK?
of the infiltrates presented within 1 week. Mean average is 3 days.
3 days.
3 days.
Okay. So all these patients were using contact lenses at that time?
Using?
All these patients were
Sterile.
on contact lens, right?
Yeah. PRK, post-PRK.
Post-PRK?
BCL was placed for culture.
Yeah.
No
Okay.
organism has been.
Any scraping was done?
Yes.
Yeah.
All cases, no organism.
And all these patients were treated with steroids?
Steroids, yes.
And they resolved, all the patients resolved completely. So what do you think is the predisposing factor for this?
There are multiple reasons. One is could be BCL steroids causes, like there have been studies with which steroids inhibit cyclooxygenase or pathway that causes more chemoattractants like leukotrienes.
Do you think it has any relation with the pre-existing allergic eye disease? Any correlation between the sterile infiltrates and severity of the allergic eye disease?
Could be, not sure.
You did not?
We have not seen.
Was there any difference in the visual outcome finally based on the duration of presentation?
No, only if the location, one has central presentation that they had a macular grade scar, so vision was less in that case. Otherwise, in the peripheral scars, vision is good. Thank you.
Thank you.